This man is living with HIV, living being the operative word. He takes his tablets, he tries to keep healthy, he lives, that word again, a normal life. And yet this man did not want to be identified. He even wanted us to disguise his voice because of the stigma that still surrounds the virus.
I've lost friends just because of my status. I've had strange looks from people I thought were my friends just because of my status. Even last year, a friend of mine who I've known for 15 to 20 years, I've had to stop speaking to because he felt it necessary to tell people.
Anyone can get it, man or woman.
It is more than 3 decades since the virus was discovered, since the apocalyptic ad campaigns.
So protect yourself. And read this leaflet when
It's decades too since we saw Princess Diana shaking the hands of a patient with AIDS, an attempt to tell the world that you can't catch the virus this way. Yet it is clear that stigma is still a massive issue for people living with HIV.
Yeah, you talk about the stigma. Is there a bit of you that feels ashamed?
I kind of am ashamed because I don't want people to look at me that way. I didn't choose this, I didn't want this, but I've got it, so I've got to live with it. Just talking to someone, you never know how they're going to react, whether it's a friend, whether it's just someone drinking or a potential partner. You never know how they're going to take this.
Now the stories of this man and others have been told in a study into the life histories of people living with HIV in the northeast of England. The report by sociologist Andrew Dalton tells of shocking failures around HIV, including around testing, diagnosis and confidentiality.
People felt a lot more isolated when it come to their GPs. For example, we had one service user who had late-stage HIV diagnosis and hadn't realised it, and went to his local GP 30 times in the space of 3 weeks. Not once had he been offered an HIV test. So there's knowledge lacking within GPs as well. And also a fear amongst non-medical staff, like receptionists and admin workers, who are in some cases moving around staff waiting rooms with HIV stamped on people's files and waving that around in their local communities.
James Hanson McCormick was happy to be identified for this film. He wants to deal with the ignorance. He told us he was diagnosed when he was 18, the day after his last A-level.
My first reaction was, what is this HIV? I don't really know anything about it.
How could you not know?
Just no education. I remember being at school and all we were ever taught about was heterosexual relationships. So a man and a woman trying to make a baby or preventing making a baby, and that's pretty much all I can remember. When I've spoken to people, other people living as HIV positive, they've had similar experiences, and it seems that sex education is really poor in like a lot of schools.
Do you think it would have made any difference?
I think if I was more aware of the risks as a gay man, I probably would have taken more precautions, but I had no idea what risks I was at, so I didn't take those precautions.
James now goes into schools to talk about HIV, filling an obviously gaping hole in the curriculum. This report was never meant to be anything other than a snapshot from the northeast of England. But there's nothing to suggest that it's any different across the rest of the country, or indeed across the rest of the world. All the experts say that stigma is still being fueled by ignorance, that you can contract the virus by sharing a mug, by sitting on a public toilet seat, or by holding hands. James indeed has his own story about ignorance.
A few weeks after I was diagnosed, I told a handful of friends, and I was out for drinks with one friend. We were having some nice cocktails. I just asked if I could try a bit of hers, and she offered to buy me a whole new fresh cocktail and it turns out that she was scared that she would be able to catch it because of sharing a glass, because she had no information about what HIV is and how it's transmitted.
Next week is World AIDS Day. The charity, the Terence Higgins Trust, will ask people to wear the red ribbon. And there is the first ever national social media campaign to be called Live HIV Neutral. Because the number of people estimated to be living with the virus increased last year to nearly 104,000 in the UK. It hasn't gone away.